Hi there! I'm going to show you how to set up and use your Accu-Chek Performa blood glucose monitoring system. Now, if you're worried about learning any of the steps involved, don't be. I'll walk you through everything to make it as simple as possible. Just follow my lead. It's all divided into small sections, so if you miss anything, you can always go back and watch that part again. Now, the first thing to do is make sure that you have everything you need to start monitoring. You should have the following items: an Accu-Chek Performa meter, a container of Accu-Chek Performa test strips, an Accu-Chek Multiclix lancing device, and an Accu-Chek Multiclix lancet drum. If you can't find something or need assistance with any of the steps that follow, just call the Accu-Chek inquiry line. Let's start by coding the meter. Coding tells your meter how to read the test strip in the container you're about to use. Take the box of strips and open it carefully. Just tear along the tab on the top of the box. Inside, you'll see some paper with technical information, a container of test strips and a small white chip. This is the code chip. The numbers printed on the top of the code chip match the code number on the test strip container label. Insert the code chip as shown into the slot on the side of the meter. Now the meter is coded to use these test strips. Wasn't that easy? When you start using a new box of test strips, it will contain a new code chip. At that time, you'll need to remove the old code chip and replace it with a new one. I'm going to show you how to use the Accu-Chek Multiclix lancing device. Please remember that the Accu-Chek Multiclix lancing device is for single patient use only. With this lancing device, there are no individual lancets to handle or dispose of, making it much easier to use. First, you will need to load your lancing device. For this, you will need an Accu-Chek Multiclix lancet drum. Each drum contains 6 preloaded lancets. So when you load one drum, you're actually loading 6 lancets. Remove the cap from the lancing device. Now insert a drum, blue end first. Push it all the way in. It should fit snugly into place. This part is important. Do not remove the drum until you have used all 6 lancets. Once you remove it, you cannot put it back in. A drum that has been removed will have a visible red line on the side as shown here. Now, place the cap back on your lancing device. The next step is to set the penetration depth to match your individual skin type. By turning the dial on the device, you can select the depth of the lancet. Set the dial to 2 to begin with. Depth setting 6 is the deepest, and depth setting 1 is the shallowest. You may need to adjust the setting a couple of times until you find the right level for your skin type. To use the lancing device, you first need to prime it. Press the plunger all the way down. The release button on the side of the lancing device has now turned yellow. This indicates that your lancing device is now primed and ready to be used. Press the yellow button to release the lancet. This will lance your finger. After each test, you will need to advance to a fresh lancet. To advance to the next lancet, simply twist the plunger back and forth once. The new lancet is now ready to use. You'll notice that the number in the window has decreased by 1. This tells you the number of lancets that you have remaining. When the number shown is 1, you're using the last lancet. After using it, you'll need to change the lancet drum. Now you're ready to check your blood glucose. First, you'll need to choose a finger to take a sample from. It's best to alternate between fingers as they can become sensitive over time. Remember to always wash your hands with warm, soapy water and dry them thoroughly before you check your blood glucose. Take a test strip from the container and always remember to immediately close the lid tightly. This helps protect the remaining strips. Always check the expiration date on the container. Do not perform a test with expired test strips. Now insert the test strip. Gold end first into the meter. The code number will appear briefly on the screen. Check that this number is the same as the code number on the strip container label. Then a small flashing blood drop symbol will appear on the screen. This tells you that the meter is ready to test. When lancing your finger, always use the side of the finger rather than the tip, as it's more comfortable and less sensitive. Now prime the lancing device. Press the plunger all the way down. The release button on the side of the device has now turned yellow. This indicates that the lancing device is primed and ready to use. Press the pinhole opening on the lancing device cap firmly against the side of your finger and press the yellow release button. This will lance your finger. Massage the finger in the direction of the fingertip to help the blood drop form. Now place the end of the test strip against the drop of blood and let it fill. When enough blood has filled the strip, a small hourglass symbol will flash on the screen to show you that the meter is working. Your blood glucose reading will be ready in 5 seconds. It's just that easy. Now you have your blood glucose reading. 2 important final steps. First, dispose of the used test strip. Then, advance to a fresh lancet by simply twisting the plunger back and forth once. A new lancet is now ready to use the next time you lance your finger. For best results and to minimise pain, you must always use a fresh lancet every time you check your blood glucose. Now you can put everything in the carry case. You'll find more information in the user's manual that came with your meter. There's also an Accu-Check extra membership card. Don't forget to register your meter so it's protected with a lifetime warranty. Isn't that easy? If you still have any questions, just call the Accu-Check inquiry line. You can also visit accu-check.co.nz. Thanks again for choosing the Accu-Chek Performa blood glucose monitoring system.